for you guys. Tomorrow we'll be doing an exclusive TikTok question session, so come and join us. We appreciate y'all being here, and as always, drop your comments in the chat. We have our content experts moderating, and let's do this. Let's go ahead and jump in. Again, we're going to be talking about burns and the rules and rule of nines. All right, so starting off, let's go ahead and define a burn injury. We're going to classify it as an accidental injury that leads to direct tissue damage due to direct exposure to either caustic chemicals, electricity, or extreme heat. So there's three main burns we're going to cover today. Chemical burns. So these are going to be caused by like caustic substances like chemical cleaning products or acids. Electrical burns. So think about burns from electrical currents like lightning or electricity from down power lines. And then thermal burns. This is what we probably typically think of when we think of burns. So thermal burns are caused by heat, such as heat associated with a flame, steam, or scalding liquids like grease. So knowing the cause of burns is helpful, but what is really going to guide the role of the nurse in burns is understanding the severity of the burn. So severity is going to be classified by a few factors, and how severity is named, you've probably heard about this, like first degree, second degree, third degree. So we're going to walk through all of those next. But again, what really goes into severity is going to be the depth of the burn, the extent of the burn, the location, and then associated complications. So before we get into that, let's review the layers of the skin, and we have tons of amazing images for you guys today. So bear with us when we're walking through all of this. And again, these are done by our amazing illustrators here at UWorld. So on our top layer of skin, we have our epidermis. Below that, we have our dermis. This is where our nerves are. And then below the dermis, we have our subcutaneous tissue. Then we have muscle and bones. So kind of those are the main layers we're going to be talking about today. And again, we have a picture that's going to talk about all of these. So, visualize it, but stick with us and we'll have some really cool images for you guys. So again, we're going to bring up our image of a first degree burn, and that's where we're going to start for today. So first degree burns are our superficial burns. So first degree is going to be the top layer of our skin, or the epidermis. So this is going to be like superficial redness on the epidermis that doesn't pass through to the dermis. It's going to look like blanchable redness, meaning that we're still going to have blood flow, and it's typically going to be painful because those nerve receptors in our dermis, they're not damaged, so they're still going to be functioning. They're going to be able to send and receive sensory information. So that's first degree. Before we jump into second degree burns, I want you guys to use that chat. Let us know what layers of skin are going to be involved in a second degree burn. So let us know. All right, let's see. I'm seeing everybody. Hello. Good job, you guys. Let us know in the chat what two layers of skin are going to be involved in our second degree burns. And to let us know, we have people moderating our chat. When are you guys taking your Nclex? We'd love to know this. And if you guys have passed and you're back for more learning, let us know that too. And we're glad y'all are here. Awesome. Very, very good. Epidermis and dermis. Good job to our friends on TikTok and YouTube. Good work, you guys. Good work, Instagram. Good job. All right, you guys kind of have it here. All right, so we'll pull up our image of a second degree burn for you guys to take a look at. But second degree burn, these are going to be our partial thickness burns. So second degree is going to mean the injury has penetrated two layers of skin. So the epidermis and then the dermis. So these burns are going to be painful because again, our nerves lie in the dermis and they may or may not have been affected by the injury. We're going to have painful blisters that rise up to the surface of the skin. That area can be swollen and weeping. We're going to have increased capillary permeability and cellular destruction. So it's almost as if the cells in our skin were like little balloons, and the damage to the burn has caused them to pop and leak out their contents. Okay, so I did see some of you guys already answer this, but I'm going to ask you another question. So go ahead, use the chat again. Before we move on to third degree burns, I wanted to ask you guys, what is going to be unique about third degree burns? And it has to do with pain, but I know I saw some of you guys answer that already, but what is unique about third degree burns specifically related to pain? So let us know in the chat if you guys know this already. Awesome. Very good. Very good. Yes, good job on YouTube. No pain. That is right. All right, so we have an image of third-degree burns that we'll pull up for you guys too. So again, same principle as we've been walking through these. Third-degree burns are full thickness burns. So same principle. Third degree is going to mean 3 layers of skin have been affected. So epidermis, dermis, and subcutaneous tissue. But third-degree burns are going to have significant edema from increased capillary permeability and release of cellular contents from cellular destruction. So they are also going to have eschar, which is like charred skin. But again, this unique feature to third-degree burns is that pain may be reduced or absent due to the destruction of the nerves that live in the dermal layer of our skin. So essentially, again, that nerve is damaged enough that it can't send or receive sensory information. Okay, 4th degree burns. We'll pull up our image for those for you guys too. 4th degree burns are deep tissue burns, and you guys can probably guess it by now. It's going to involve 4 layers of skin. So epidermis, dermis, subcutaneous tissue, and either muscle and or bone. So these are largely going to look like 3rd degree burns. So we will see edema and eschar, reduced pain from damage to these nerve receptors also. Okay, so we've kind of covered how we can get burns, the different severity of burns. Now we're going to jump into complications. And so before we do that, I want you guys to tell me what complications do y'all think of whenever you think of burns. So what do you feel like are some of those priority complications we need to monitor for? So let us know. Good job, everybody. I saw some people with their Nclex date coming up, so best of luck to y'all. We have our 7-day free trial you can always check out for some last-minute question practice. All right. Oh, good answers coming in. I'm seeing contractures, electrolyte imbalances, dehydration. Very good. Shock, hypovolemic shock. Good job, you guys. A lot of awesome answers coming in. Very, very good. Fluid deficit, dysrhythmia, very good. All right, good job, you guys. Okay, so we're going to pull up a table for you guys. We hope this can be helpful for you. Again, this is going to cover some of that big, heavy-hitting information about burns. Not fully, fully inclusive of everything you need to know about burns, but hopefully something that can give you some good reminders. So one of the biggest things we need to think about when we think about burn injuries is the risk for an inhalation injury. So these are caused by inhalation of smoke or extremely hot air, or even aerosolized toxins. So we can see inhalation with injuries with chemical burns and thermal burns. So these are going to injure the lungs and respiratory tract by causing life-threatening laryngeal and pulmonary edema. So what is going to happen with pulmonary edema is gas exchange is going to be impaired. This is going to happen from fluid accumulation in the lungs. So laryngeal edema is going to take things like a step further, and your airway is going to be totally obstructed due to swelling in the upper airway. So when you break this down, like remember our ABCs. Laryngeal edema is going to be A for airway, and pulmonary edema is going to be B for breathing. So this is why it's so important that we need to identify inhalation injury, that we know it's occurred, and that we know we need to take action immediately for these. Again, we're so worried about our airway with these injuries. With an inhalation injury, a lot of time these clients are going to need to be intubated. So we need to recognize what these look like and take action before the injury progresses too far. That makes intubation a lot harder than it needed to be. Okay, so with that being said, what do you guys know inhalation injury can look like? So again, put your answers in the chat. What are some signs and symptoms of inhalation injury? Let's see what we think. Yes. Oh, good job, Jamie on YouTube. Soot, that is definitely true. We're going to cover all of these. That's a great answer. Wheezing, good job. Cough, good job, you guys. Trunk affected, that's a great answer. Breathing difficulties, airway closure, facial burns. Good job, you guys. Awesome. Great answers, everyone. All right, so we'll walk through some of these, but you guys definitely have the right idea here. But clients that are at risk for inhalation injuries, these are what we're going to see on them. We're going to see some burns on the face or the neck, singed nasal hair. Again, this can be related to thermal burns, so losing our nose hair from like exposure to extreme heat. Soot-tinged sputum from inhalation of smoke, coughing, wheezing, or stridor. Again, remember, stridor is auscultated in our upper airway. Pharyngeal edema or blisters, so like swelling in our mouth, and altered mental status as well. So this is going to happen from impaired gas exchange and impaired oxygenation, and this is also going to be a sign of carbon monoxide poisoning. So carbon monoxide is released from burning materials, and when it's inhaled, it's going to bind to our hemoglobin, and it's going to give us a false sense of oxygenation. So this can lower our oxygenation saturation. So knowing all of this, if our client is showing any signs of inhalation injury, we need to treat them with 100% oxygenation via a non-rebreather mask or even a bag valve mask. So we're also going to need to prepare them for endotracheal intubation. So if we don't get them intubated quick enough and we cannot pass the equipment through the airway to support the airway, then we may have to do a tracheostomy for ventilation. So inserting an airway kind of like below the mouth. For this reason, this is exactly why we cannot delay identifying inhalation injury when we're dealing with burn injuries. Again, it's all about our ABCs, all about supporting our airway. Okay, so that's kind of our main big complication that we're going to talk about with burn injuries, but we're going to talk about some other ones equally as important. But when you think burn injuries, really think about those inhalation injuries. Okay, other than that, let's talk about hypovolemic shock. Okay, so hypovolemic shock, we'll walk through how this all happens, and like why we're worried about this. But again, we've talked about this a little bit. So burns can cause damage to our cells, which is going to cause the cells to rupture and leak contents. And when burns also, they're also going to cause increased capillary permeability. So this is going to cause fluid to leak out of our cardiovascular system and into our tissues. So essentially, you're going to have a massive fluid shift and electrolyte loss from our circulatory system, and the shift of fluids from circulation is going to go into our tissues, or this is also called third spacing. So when we have decreased circulating volume, we're going to be at risk for hypovolemia and hypovolemic shock. So, as always, we try and tie this into those major big picture complications. So if we have decreased circulating volume, we're going to worry about perfusion to our vital organs. So think about our heart, our brain, our kidneys, all of that. So that's a big complication, and that's why fluid resuscitation is such a big part of burns. Okay, next big one, compartment syndrome. So we have another image that we're going to bring up for you about this, but essentially compartment syndrome can happen with our circumventual eschar, or a burn that happens like around an extremity or around our torso. So what's going to happen is the skin is going to become tight and non-elastic, and so it's going to prevent blood flow through the extremity or like through our torso. So again, that swelling is not going to allow for expansion, and our vessels are going to compress, and we're going to lose blood flow to anything like below the site of injury. Okay, we'll pull our table back up for you guys. Working our way through these big picture complications of burns. We also worry about infection and subsequent sepsis. So another major complication. Skin is like our first barrier to the invasion of pathogens into our body. So if that barrier is injured, we're going to worry about pathogens entering into our bloodstream. So that's a big one too. We're also going to worry about stress-induced hyperglycemia. So our body is going to be in an extremely hypermetabolic state, and we're going to be releasing excess cortisol, and that's going to raise our blood sugar. We're also going to worry about malnutrition. So again, same concept that we just talked about with being hypermetabolic. Our body is going to be trying to heal these burns as fast as it can, and it's going to use all of our energy stores quicker than it normally would. And then, of course, mobility issues, especially if burns are on extremities. We're going to worry about complications from immobility, also contractures or shortening or tightening of our muscles. Okay. before we talk about what we're going to do as a nurse, we're going to talk about the rule of nines. So we have another image we're going to bring up for you guys, and this is going to show how our body is divided into the rule of nines. But we're going to walk through why we need to know this and how we're going to calculate it. Okay. So the reason we need to know about the rule of nines is we need to know it for fluid resuscitation. So again, that's a huge part of how we treat these clients. So we need to know about the total body surface area affected by these burns. And that's going to really kind of guide us in what our fluid resuscitation looks like. So we're not going to talk about like fluid resuscitation calculations specifically today, like things like the Parkland formula. That's not something that you need to know for the Nclex, and that's going to be nursing school specific and facility specific, what type of fluid resuscitation equation you learn. But we are going to talk about the rule of nines and how to calculate the rule of nines. So again, we need to know it because we need to calculate how much of the total body surface area has been impacted by these burns. So we call it the rule of nines because every body part is considered either a multiple of 9 or divisible by 9. So again, when we're looking at it, we need to consider the front and the back of the client, so the anterior and the posterior of the client. So when we think about it, some examples are going to be like the front of our legs are going to be 9% each, and the back of our legs are going to be 9% each. So if you have one full leg that's been burned, that's going to be 18%. So we're going to need to know that number to then calculate into our fluid resuscitation equation. Same idea, our head, the front of our head is going to be 4.5%, so half a 9. The back of our head is going to be 4.5%, so our full head is going to be 9. Arms, front and back are 9 each, and our torso is going to be 18%. So if you just think about 9 and you relate it to like knowing a full arm is 9, you know the front of a leg is going to be 9, but a full leg is going to be more than that. So just, it all makes sense when you kind of think about it, but just have a good benchmark. An arm is 9, a full head is 9, our torso is 18. And again, we'll do a practice question at the end where we put our knowledge to the test. Okay. So we're going to bring up our table again, and we're going to talk about some interventions. So what we're going to do for these clients with burns. Okay, so we're worried about airways. We talked about our ABCs. We're going to position the client in a high Fowler position if they have a suspected inhalation injury, and we're going to do this until we can get them intubated. We want to promote as much airflow as possible. We also want to remove clothing and jewelry around the burn area, especially with chemical burns, because those chemicals are going to sit in the fabric and continue to cause damage to the skin. Okay, question for you guys. What are we going to do if clothing is stuck to the burn site? All right, and thank you to everyone who's sharing our video. Make sure you guys follow us too. We have a lot of great information on here. Again, let us know what you guys do if clothing is stuck to the burn site. Yes, and again, follow us on TikTok. We really we're almost to a big milestone of followers, so help us get there. And it's not too late to share this video either. Oh, good job, Jenny. Do not attempt to remove. Leave it be. Good job, you guys. Great answers. Awesome. Good job. Do not try and take it off. Good answers, you guys. You definitely have it. Awesome. Okay, so we're talking about interventions we're doing as a nurse for these clients. The client has a burn. We're not able to remove something. What are we going to do? We're going to just remove as much as we can, and we're going to leave what's stuck. We don't want to try and pull anything off and cause more damage than what's already happened from the burn. Okay, so we're also going to flush the area with cool water. We don't want to use cold water. That's going to cause more damage. Again, cold is going to constrict. We want to encourage as much blood flow as we can to this area to help kind of facilitate that healing process. And we don't want to use warm water. We want to cool the site down. Once we have our airway secure, we're going to do some initial and we've done kind of our initial interventions. We're going to want to give IV fluids. Again, this is going to be something you'll learn specifically in your nursing school or at your facility, but equations like the Parkland formula, knowing how much our total body surface area has been affected, that's going to indicate how much fluid we need to replenish these clients with. We also want to consider inserting an indwelling catheter into these clients. We want to be able to measure precise, inputs and outputs, especially if we're worried about impaired perfusion to our kidneys. And also, if these clients have experienced a genital burn, like something spilled on their lap, we want to be able to protect that urinary tract and allow that urine to pass freely, and protect the skin too from urination. We also want to put these clients on continuous ECG monitoring. So we're worried about that burst of that intracellular fluid entering into our bloodstream. We're worried about hyperkalemia, and we know hyperkalemia can cause a lot of dysrhythmias to our heart. So we want to monitor for any of those kind of potentially fatal dysrhythmias. We also want to treat these clients with pain management. IV opioid pain management is going to be pretty crucial for these clients, especially if those nerve receptors are still intact. We want to treat them initially, in the acute stage of their burns, but we also want to treat them chronically when we're doing dressing changes, things like that, being able to pre-medicate them and perform a dressing change, with as least discomfort as possible. And then we also want to minimize heat loss and provide a warm environment for these clients. Again, our skin helps us regulate our core body temperature, and when that's impaired, our body temperature can drop significantly. So we want to keep them warm and protect them from developing hypothermia. Okay, we're also going to administer an immunization to these clients. Do you guys know which one it is? Let us know in the chat. Let us know. All right. Let us know what immunization you want to give these clients, and we'll walk through why about it. All right. Oh, good job on YouTube. Good job. Good work. Oh, I'm seeing a lot of right answers come in. Good job, you guys. Good job on TikTok. Awesome work on YouTube. See some Instagrammers coming through. Good job, you guys. Awesome answers. Wow, I'm very impressed. This was like a refresher for me to remember this one, so I'm glad you guys know it. Okay, so we are going to want to administer a tetanus immunization if the client is not up to date. Again, tetanus is a very dangerous infection. It can live in dust and soil, and again, when our body is exposed to these potentially harmful conditions, we want to protect it as much as possible as these tissues are trying to heal. Okay, we also are going to want to encourage a diet high in two things specifically. I'll let you guys put your answers in the chat, but these are going to be things, one's probably going to make sense, but the other, I'm curious to know if you guys know this already, but we want to encourage a diet high in two things for these clients. So let us know what you guys think it is. Oh, good job. Good job, Sharifa. Good answer. That is definitely it. Good work, you guys. Okay, maybe not as challenging as I was thinking. You guys definitely know this, so good work. All right, good job, Jamie. Awesome answers, you guys. Good job. Protein, I knew you guys would get protein. That makes sense. But the other one is carbohydrates. And so we kind of talked a little bit about this, but we need to give our body more energy to repair the tissue. So again, we're in that hypermetabolic state. We want our body to have the energy it needs to work a little bit harder as it's trying to heal itself. And then last but certainly not least, we want to offer these clients emotional support. These clients are going to experience a lot of emotion during treatment and recovery, especially if their physical appearance has been impacted or changed dramatically. We want to be able to provide them with that emotional support. So think about those therapeutic communication questions and how you can therapeutically respond to these clients and how you can therapeutically deliver information to them. Okay, so there's also a few surgical procedures that a client with a burn injury may experience. So as the nurse, we're not going to perform these procedures, but what we can do as the nurse is prepare them for these procedures. So these these procedures are going to be surgical debridement of the wound, or essentially surgical cleaning of the wound. It's also going to be surgical excision or graft. So we might need to have a skin graft put on for these clients to cover any non-healing tissue or, provide a barrier to the skin that isn't going to heal. And then last but not least is an escharotomy. So again, we'll pull up that image of compartment syndrome again. But as you can see in there, we talked about this a little bit earlier, but in the image, you're going to see that swelling in the arm and how it's compressing down on those vessels. So a surgeon is going to come in and be able to kind of cut into the skin and relieve that pressure so we can restore blood flow and help save as much of that limb as possible. Okay, last section, we're in the home stretch, and then we'll pull up our questions. So teaching, what are we going to teach these clients after discharge? They're going to oftentimes require physical therapy or occupational therapy to rehabilitate, so we want to encourage this. We also want to teach them about any, prescribed splints or compression garments. This is going to help prevent swelling, help, promote that venous drainage back to our heart. We also want to teach them about wound care. This is going to look different for every client, but we want to make sure at the time of discharge, they're equipped to be able to handle their wound at home. They know the proper technique and they have the proper supplies. We also can teach them about antihistamines, that these might be helpful to help manage some of that itching that happens with as our skin is healing. It can be tight and itchy, so antihistamines can be a good way to kind of manage that symptom. And then sunscreen, so important for everybody, but sunscreen, we need these clients to protect that skin, that new skin that's growing. If they have a graft, all of that, we want to protect that skin as much as possible. So all those sun protection measures like wide brim hats, long sleeve clothing, wearing sunscreen, just avoiding the sun as much as possible. And then again, making sure that their psychological needs can be met, making sure they have access to any mental health resources that they might need. Okay, we did it, you guys. We're going to pull up our question. This is a question about the rule of nines. So I'll read it, give you all some time to answer, and then we will go from there. All right, so our question says, the nurse is caring for an adult client with partial thickness burns to the posterior torso and the anterior and posterior surfaces of both the right arm and a right leg. Using the rule of nines, what percentage of total body surface area affected should the nurse document? Record your answer using a whole number. All right, let us know what you think. Good job, you guys. And for anyone, this will also be available on demand after the session is over. So if you have any questions about any of this or want to review anything, you can always check it out. Oh, good job. Good job, Jamie. Good work. I think you're coming. Yeah, good job, Jamie, on YouTube. Great answer. Good job. I'm starting to see some good numbers come in. All right. Good job, Christopher, on YouTube. Good job, Christina, on YouTube. Good answers on YouTube today, guys. All right, let's see. Here come our TikTokers. Good job. Good answers. And good job on Instagram. Good calculating, guys. Ooh, here, it's going fast now. Okay, good job. Awesome work on Instagram. Come some more TikTokers. Okay. Guys have it. All right. Okay, so the total body surface area impacted, the answer is going to be 45%. So we have our posterior torso. Again, the front of a torso or the back of a torso is going to be 18%. We have the anterior and posterior of a right arm. So again, a full arm is going to be 9%. And then we have the anterior and posterior of a leg. So again, front of a leg is 9, back of a leg is 9, so 18. So we have 18 plus 9 plus 18 is going to be 45%. So you guys did great, a ton of great answers that came in. You guys definitely know this. So, well, that kind of wraps us up for Burns today. We thank y'all so much for joining us. Again, come back tomorrow on TikTok. We're going to have an exclusive TikTok session for you guys. And as always, check us out on our website. Visit us at nursing.uworld.com. We have a 7-day free trial you guys can check out. We have tons of amazing content on there. We have questions. You can see what we're all about. Our explanations, our illustrations. We have lecture videos, flashcards, note cards, everything. But we know practicing questions is one of the most effective ways to help you guys prepare for the Nclex. So that's what we're trying to incorporate into these live sessions, what really the foundation of UWorld is. So check us out. Make sure you guys are following us. We have a lot of great information coming up and sessions for you guys. And then again, come join us again on Thursday at noon on your favorite channel, and we'll be doing a rapid fire session about cardiac meds, kind of hitting some of those most important things to know. So we appreciate y'all joining. We hope to see you next time. Thanks again. Bye.